Okay, I'm kind of jumping around, but this is what I provided the Pentwater police, saying, look, they gave me all these drugs, so I wanted to let them know what, this is what Xanax does, how Xanax reacts to different things. So it's like, avoid using other medications that make you sleepy, such as cold medication, which I told you I was taking NyQuil, pain medication, muscle relaxers, baclofen, and medicine for seizure. Well, it doesn't apply. They can increase some of the side effects of Xanax. What are the side effects? Well, I'm glad you asked. What are the possible side effects of Xanax? Let's look at this. Call me crazy. Hyperactivity, agitation, hostility, hallucinations, depressed mood, and all these other things. But you know what? You give me Xanax on top of all this other stuff, I'm going to act a little crazy. So, come on, police. I gave you this. You don't have to do your own homework. I told you. What does this say? Drowsiness, dizziness, feeling irritable, muscle weakness, lack of balance or coordination, slurred speech. Oh, God. Oh, this is how much they gave me. But I got a breakdown on that. We don't need to do that now. So yeah, that's the pill I remember them giving me. So it's this dose that I remember them saying, here, take 2 of these. And they admitted to it. Benzodiazepines, I tested positive for this. I don't want to go into everything, but, it's me shoving in Pentwater police. Look, herpes, and then this. Okay, we got to do it, folks. I'm sorry. I hate doing it too, but if I got to present my case, without treatment, when I have the documents that say I had this, and that's already been shown in a way earlier video, and I'll probably have to do it again. But without treatment, it results in rapid death in around 70% of cases. Even with the best modern treatment, it is fatal in around 20% of cases treated and causes serious long-term neurological damage in over half the survivors. Do you get it? I'm not mad at you guys, but can you see how agitated I was where I find out that Hackley Dr. Quack is diagnosing me as herpes simplex encephalitis, where now I'm like kicked out because I'm getting belligerent with them, and then they don't treat me? And it's like, okay, what is going on? And you're making me take antipsychotics, and I don't want to take those anymore, but you kicking me out saying I have this? And then it's like, you're not doing anything? Oh, good God. So then I'm trying to, it's like, someone take care of me because I think I'm going to die. Oh my God. I can't believe all this. Anyway, for unknown reasons, the viruses seem to target the temporal lobes. Yeah, like a remote infarct 4 by 13 millimeters. A small population of survivors, perhaps 20%, show little long-term damage. So I'm thinking, they took the little egg beaters inside my head, and I think I got a small chance of coming out of this without being unscathed. So again, the virus usually infects through the mouth and enters the nucleus of the nerve cell during the first 7 days and will remain latent for 10 days to 10 years. And will then reactivate from common stress. I was suffering from uncommon stress, fever, or sunburn. It's like, what? It's like the least of your issues are sunburn. Oh, don't go on and get tan when you're freaking out and your head's baking. The virus will soon be contagious through more cold sores, and the disease will start to attack the brain. So, do you get it? Kind of didn't know what was going on? Encephalitis frequently begins with flu-like illness or headache. Taking NyQuil, Mick freaks out that I say, what are you taking NyQuil for? Oh, God. Typically, more serious symptoms follow hours to days later. The most serious finding is an alteration in levels of consciousness. This can range from mild confusion or drowsiness to loss of consciousness and coma. It's like, yep. Other symptoms include high temperature. I think either I'm checking, it's confusion, drowsiness, loss of consciousness. High temperature, seizures, fits, aversion to bright lights. Thank you, documentation. So the freaking out at red lights, inability to speak or control movement, sensory changes, neck stiffness, or uncharacteristic behavior. Right, red lights in ER, ceiling tiles moving. Oh, yeah, dancing. You've got, you count the little holes in the ceiling tiles, those old asbestos tiles or whatever they were, but you try counting the rows and knock me down, and you're just like, I gotta keep busy while I sit here in all this agony. So hyperventilation, plus. Oh, I did. I just, then I'd stop. Randy Pentwater PD to document, and he did. Oh, thank you. What else did I write? Oh my God. Devil's in the details. Devil's in the details. What else do we have, Mr. Teacher? Okay. Some people may also experience hallucinations and vivid nightmares. Now, this is the interaction for Xanax. Do we need to refresh? I hope not. I'll scan back, but this is the reaction to Xanax, which they admitted, they being Mickey and her father, admitted to giving me 25 milligram or 0.25 milligrams of Xanax on top of the prescribed meds. They admitted it. So, what else do we get? We get to experience hallucinations and vivid nightmares during the acute period of the encephalitis. Oh, no. This is herpes simplex encephalitis. Thank you for bringing that to the attention. This isn't Xanax. This is herpes encephalitis. Sorry. You guys probably knew that and didn't tell me. Why are you letting me go on? And I just babbling. At least I can edit it. I'm talking to myself. Agitated and aggressive behavior. Oh, okay. So this is where I'm thinking my brain's cooking. So I'm agitated and aggressive behavior is not uncommon during the acute phase of encephalitis and after. This may occur because the patient is neurological agitated due to the swelling and inflammation in the brain. As the patient begins to recover, they may enter a phase called post-traumatic amnesia, PTA, and behave extremely out of character, becoming aggressive, uncooperative, or violent. So I'm sorry. This is not the Xanax. This is when, confirmation in my mind, my tiny little brain, what's left of it, that I'm done for. I'm done. I gotta write jail or something. So, the family must realize that this is not within their loved one's control, unless they give them the drugs. They are not conscious or aware of their behavior or the impact it is having on those around them. The image of a patient who experiences injury to the brain and perhaps coma, who are calm and waking serenely to the delight of their family, is a myth perpetuated by television and other media. A loved one is more likely to be confused, disoriented, aggressive, and rude. Wait to see what Hackley wrote about me. Yeah, Dr. Quack. You're going down, Dr. Glenn. It has not been known for patients to abscond from their bed during these stages of agitation. It has not been unknown for patients to abscond. I don't know what that means. Oh, those are... Okay. Post-infectious. The illness usually follows in the wake of a mild viral infection, flu, such as that caused rashes in children. Allergic reactions to benzoin maybe 3 times, or penicillin 3 times, or immunizations. Typically, there's a delay of days to 2 to 3 weeks between the triggering infection and development of the encephalitis. Oh, God. So excuse me. So I let them know. By age 10, I had 3 severe outbreaks of allergic reaction to penicillin. 10%, 30%, 100% body reaction. Starting out with feet. Oh, and I scratched my leg so much after a penicillin outbreak that I had scars. I mean, if you look real close, it looks like dried skin, but it's actually scars because I scratched myself raw. I was in tears. It was like, do I go for the itch or do I go for the sting of scratching raw? And I went for raw. Oh my God. But the scars there, it kind of looks like dried skin scars. Because it looks like dried skin, but you kind of, it's like, oh no, that's, you pick at it, it's like, oh, there's nothing there. It's, it's like, this guy is multi, but never explaining. And it's, of course, if I read a little bit further, so it's enough to make BSG order. Oh, Brian S. Glynn. So all these reactions were enough to make Brian S. Glynn. So he had Dr. Quack had the same initials as me, but a little bit backwards. But Dr. Glynn to order an MRI after 4 days of observation and failure to react to meds. So when they start realizing I'm telling the truth, they're like, whoa, this guy is cooking. And then they go, well, we'll just blame it on encephalitis and kick him out of here and not treat him. Oh, God. Can you guys kind of get what I was going through? Funny ha-ha for you out there, but go through it. So what else? Diagnosis. Okay, I got to make sure. We're still on herpes. And I apologize. I thought we were on benzoid or something. Herpes simplex. Encephalitis. So we're on herpes still. And I thought of all things, I got to go with herpes simplex. But no. We've got a better one. Arachnophobia. But not just arachnophobia. Or, arachnoiditis. Arachnoiditis. Because that kind of sounds like arachnophobia. We have to give you chronic adhesive. So not only am I afraid of spiders, but sticky spiders wrapped in masking tape. Oh, he's got having a good one on this. Oh, good. So here we go. We're still in encephalitis. God. Man, if you're not interested or getting a chuckle, sorry, no pictures, but I don't think I need pictures. So diagnosis. Very important to differentiate encephalitis from other disorders that may cause similar neurological symptoms, which may have very different treatments. Disorders that mimic those of encephalitis include bacterial meningitis, stroke, brain tumors, which I thought at one point, drug reactions, Could you say that again? Drug reactions and metabolic disturbances, What was that again? Okay, you can read it. Symptoms alone often do not allow a doctor to distinguish between the many diseases that can mimic encephalitis, and therefore a variety of hospital tests are required. Dr. Quack, did you read your own information? They didn't provide this to me, but a little Google search did. And if Dr. Civil Engineering can find it, Dr. Quack can find it. I rest my case. So, tests can confirm the diagnosis and rule out other disorders. Really? What kind? Like a CAT scan or an MRI? Oh, look, Brian, you spoke too soon. Brain scans. Did they do this? Oh, yeah, they did. Computerized tomography, CT, CAT, and or magnetic resonance imaging, MRI, scans may show the extent magnostic resonance show the extent of the inflammation in the brain and help differentiate encephalitis from other conditions. Brain scans can exclude stroke, brain tumors, and aneurysms. Can Dr. Quack read an MRI? Don't think so. In early stages, brain scans may show nothing abnormal, with significant inflammatory changes only occurring later in the illness. Wow, I wonder if the reports say that there's significant inflammatory changes. Yeah, there is. EEG. Oh, of course they did. EEGs, which records brainwaves, can detect abnormal patterns of activity. Abnormal patterns found in encephalitis include showing of brain activity as well as epileptic seizures. Yeah. Lumbar punctures. If I had $1, 8 to a dozen. I don't even know. 8 to a dozen. Lumbar punctures allows a doctor, plus my little punctured Durasac in 94. So, okay, so, so this is a potential, like, yeah, I had that, and then spinal cord, yeah, 94, then CFS is produced within the brain and flows out the base of the brain, cerebrospinal fluid. So, yep, I had a leaky spinal cord, so I was like, okay, not performed. It was like, oh, they could have done this to see if I was leaking anymore, and they didn't do it. Lumbar puncture, so they could have determined if I was leaking or not. Then that, so I'm just going with what I highlight. Immediate test performed on cerebral or the fluid, spinal fluid, include analysis under the microscope to assess the number of type of white blood cells present. A raised number of white blood cells in spinal fluid are indicative of inflammation within the brain, spinal cord, or lining of the brain. You wait till you see the blood reports and the ones that disappeared, because I have some tests that say tested positive, then I have other tests that said I tested negative. So what they did was they destroyed some evidence, but they didn't destroy all the evidence. That's why I said send me all the records, because I know on the short term they couldn't destroy everything. In fact, one day after my little brief encounter with Dr. Quack, as soon as he went out of the room, I heard the shredder going off. And he came back in the room. I go, what are you doing, shredding everything? He goes, well, you sound paranoid. I'm not shredding everything. I go, well, what were you shredding? He goes, I wasn't shredding anything. Oh, God. But that was after I said, what are you, and they were destroying stuff. But not all of it. Not all of it. You can't just, you guys haven't done investigations like I did. More complicated tests. I'm not bragging the point, but I'm just saying is all this background that God allowed me to give, I was trying to stay on top of it, checking. I know how these games are played. So you obfuscate someone with a bunch of documents. No, I'm going to go through those until I find everything that's going on and catch your contradictions. So I had the hospital for falsifying things. I had ARDC for changing things. Oh my God. All to no avail. So more complicated tests. So I was kind of cheesed because these guys could have done a yes-no if they'd done this lumbar puncture to see if I had more. But I had white blood cell counts that were diminished. So what was going on? So that's all that. So WBC raised from... Oh, these are from my record, so I have copies of this. White blood cells raised from 4.5 to 7.8 in 16 hours during initial stay. So I have documentation for this. You guys can see it. So this is if I highlight it, I've got proof. Because I'm not just going to go babbling saying, yeah. Sorry, I'm only at 20 minutes, so I'm okay. Oh, here we go. The infectious causes of encephalitis cannot be determined in approximately 60% of cases. So, you guys diagnose this? You diagnose it? But that only gets done 60% of the time, but you guys went ahead and diagnosed it? So why didn't you treat me? Why didn't you treat me? And remember the medical records, I have to show them again. It said, was a provided... Oh, I have to do it now. I can't be hopping, skipping, expect you to do that. Hold on. Okay, hold that prior thought. And now we're back to Hackley records. Okay? This is their records. Nothing I did. I did not do a... This is not a Hawaiian birth certificate. So anyone can look at this and do the negative and reverse, and there's no added things here. God. MRI of brain. That's not Stanley Pleasance. That's my brain. It's Brian's brain. Brain Brian. And let's make sure who's doing this. Brian S. Glenn, BSG. Dr. Quack.
Good evening, ladies and gentlemen. Welcome to the 67th Annual Academy Awards. I won't lie to you. I'm very, very excited. And I've been dying to do something all day, and I think maybe we can take care of this. Oprah? Uma? Uma? Oprah? I feel much better.
You're going down, buddy. I don't care where or what you are these days. You're going down, or your reputation's going down. Because you are a menace to your profession. Come sue me. I want to go to court. Patient is a 47-year-old male with provided history of herpes simplex encephalitis. Who told you, Dr. Glenn? My question that I threw at you 1,000 times? Who provided history of herpes simplex encephalitis? Did you make that up? Did someone tell you? Tell me, because this is all I had going on with my brain's cooking.
You doctored the logbook.
Damn it, Cappy!
You coerced the doctor.
Consider yourself in contempt.
Colonel Jessup, did you order the code red?
You don't have to answer that question.
I'll answer the question. You want answers?
I think I'm entitled.
You want answers?
I want the truth!
You can't handle the truth. Son,
Axiocoronal and sagittal images were obtained using blah, blah, blah. Diffusion sequence is always from no prior study. So ventricular type, there's no blah, blah, blah. There's elongated area of diminished signal oriented in an interior-posterior fashion along the lateral margin of the right thalamus, measuring up to, this is a hole in my brain, measuring up to 13 millimeters in length and 4 millimeters in width. This likely represents an area of prior ischemic involvement, meaning prior history of herpes, provided history of encephalitis. This likely represents an area of prior ischemic involvement. The diffusion sequence shows no evidence of an acute infarct, meaning provided history. Oh my God. You don't have to be a brain surgeon to understand that. Oh yeah, you do. I love saying that joke because it just never ends for me. What, you have to be a rocket scientist? No, that doesn't work. You have to be a brain surgeon to understand? Yeah, kind of. Okay, what else documentation do you have, Dr. Perry? Brian? If it's not highlighted, I'm going to have to come back. I want highlighted. Here we go. I'll come back if it's pertinent. I think I might have enough. It's like, what are you hiding? I don't know. I'll go back. So where are we? Hackley, the cuckoo's nest. Let's make sure who we're ranking. Is it involuntary? We'll find out who wrote this. November 26th, so it all happened on the 25th. 21st through 25th. So 2:50 in the afternoon. This is Monday, 2007. No, it's not a birth certificate. That's 2007. That's their little stuff. Chief complaint. This is me. I wasn't feeling well today, finger moving. I want to play piano. My mother was a psychiatrist. It's okay. Now, he wrote down what he wanted to do. He had a picture of a piano player in his office. And I said something about, I always want to play the piano. But this is when I'm playing back and forth. I don't know. Say I'm acting weird. I don't know. But, see, it's going to sound like, well, you are chlorine up. No, I just don't recall exactly, and I just don't want. So they for some reason for admission, they have Chlorazil and renal problems. At first I was like, renal? It sounded like anal, and I thought, I don't know what was going on there. The past, my father thought I should be a psychiatrist. I have no idea what was going on there. Risk assessment high. Listen, ASA, I don't know, Tylenol joint pain. Here we go. History of present illness and precipitating events. Onset of illness, acute symptoms and behaviors, duration and degree of impairment, long time. Past psychiatric history, including hospitalizations and medications. I don't know what IP is. Northwestern, Evanston, Houston. Orthopedic. Do we have enough evidence of that? And someone's telling them, oh, he thinks he has knee surgeries, but those were psychiatric evaluations. Let's move on. Again, well, I don't want to blow through. It's like, well, you're hiding something. No. Let's see what it says. If it's not highlighted, I don't care. Digital recordings, blah, blah, blah. So, bizarre behavior. So this just describes the test. Hyperventilation was not performed. Sleep was not seen. So this EEG is within normal limits. Specifically, no focal or seizure features are noted. So, guys, that's what you're not missing. Let's see what you're not missing again. See, you guys are making me do this, not me, even though no one's there. I get it. I'm just doing what I'm doing. Digital recording was made. Oh, it's a repeat. Oops. Here we go. So who are we? Hackley Hospital. Dr. Brian S. Glenn. You're going down, buddy. You're going down. So my home phone. I gotta find the thing that says unemployed, because that's my favorite. Diagnosis. Herpes simplex. So we've got two documents. Herpes simplex and encephalopathy. Confusion, bizarre behavior. Has patient been diagnosed with kidney disease? No. But I thought I came in with anal problems or renal problems or whatever. Isn't that the kidney? Wait, you've got one even though that's MRI, it's like you got one document saying I got renal, you got another one saying I'm anal. What is going on? Or renal. Wait, you need to be a brain surgeon to understand that? Any previous surgery to area being scanned? No. Any previous surgery to, well, I guess that's head. No, I haven't. Any history of cancer? No. Okay, so you're okay so far. Has patient ever had metal in their eyes? Ever. You guys are like Randy. I school R. Goodley. Metal grinding, unknown. Okay, you didn't know. Does patient have a pacemaker, pacing wires? No. You got a few things right, thank you. Patient have any implants of any kind in their body? Yes. Titanium in spinal area placed, I guess that's approximately 3 years. So they knew, somehow at some point they knew I had hardware, but just wait, we got conflicting documents. Is patient pregnant? They got another thing right. Patient ambulatory. Yes. What does that mean? Ambulatory. I should know what that means. I don't know what that means. He is an idiot. I know, but does that mean I can move or not move? Ambulatory? Whatever. What previous studies have been done on the area being scanned? CT negative. But you did your MRI. Where's that? When and where were they done? That's Shelby Hospital. Verbal order, Dr. Glenn. All right, moving on. That's the same thing. Well, really? You're confusing us. That's the same thing. Right. I hope it is. Yep. Is he pregnant? That's the thing. Is he pregnant? No. Okay, it was the same thing, guys. Don't get excited. What else? That's my letter to Bose. Okay, I freak out on one. Well, you know, you guys can record this. This was, I go nuts in one. So this is when they sent me, I send them a check. I go, whatever it is, just write in the number, cash the check, but get me my documents right away. And the thing is, I had a communication going on with records, but I had another communication going on with the, Dr. Glenn. So he thinks my only contact is with him. So they can stonewall me, but records doesn't know what's going on, and they send me all my records. So they sent me the $250. I get a letter from them saying, well, we need to know, to request what you're going to do with these. So they stonewall me. Meanwhile, I go behind their back. They think they can stonewall me. Am I rattling too much? Look, this is how much. $521. That means that's how much 240 pages cost. Anyway, so I was kind of like, okay, you guys look over here. I'm going to make sure I get those records before you get to clean them up. And that's exactly what happened December 14th. So I got my records before you knew even what was going on. I ain't been around the block once, and I think this is when I freaked out. Oh, no. So they think they get one letter. This is the other one that got sent. Let's take a quick peek. So it's all on the record. Ooh, I got nasty. I saw a bad word. Let's find out what I wrote. December 12th. Hackley. Records. To whom it may concern, and it damn well better concern a lot of you. Enclosed, please find check 1056 in the amount of $73. So I got to remember what's going on here. The personal check is presented in order for me to receive a complete copy of my medical records from my brief vacation between approximately, between approximately November 24th through December 6th of this year. During that time, I was under the completely negligent care of a doctor, if in fact that is what he is, or was, or whatever. Dr. Brian S. Glenn, the S he claimed was for shithead, but I seriously doubted that. Only Steve Martin in the movie Jerk called his dog shithead. Okay, this is the funny one. So I sent 2 letters. So this is the bogus one. This is funny. To my knowledge, no sane human being would ever name their child, especially the middle name shithead, unless a personal vendetta, blah, blah, blah. So this was the bogus letter that went on, where they're thinking like, oh my God, what is going on? And I go, come on, I just get on. So I just go on. You guys can read this. But I never sent this letter, but I used it. I used it to Dr. Glenn saying, look, buddy, this is after I've already got my records. So they're thinking like, oh no, he's already got everything. So I'm going full blown crazy at this point. Yeah, it is. And then I start arguing with myself. And then this went on for another couple pages. Look at it. Yeah, why not? You guys can read it if you catch it. So let me see. So I think this was this is July. See, I'm in the middle of something. Let me go back to the herpes thing, because I think that's why I jumped over here. Let me double check. I have nothing highlighted, so abnormalities are not consistent. Well, what did it say before? What page is 14? He's skipping stuff. 6A. You know, one thing, I don't know if I have all 240 pages, though. He's hiding the truth, you know. I don't know. So something abnormal on his... Oh, so they were kind of Warnick, Carson. They had me for Asperger's. Oh, you just wait. He seems to be schizophrenic. And of course, I'm not a psychiatrist. So they had, like, this is discharge summary. So they had people reading notes upon notes upon notes, giving, you know, what's your opinion? What's your opinion? This guy says he appears to be schizophrenic. And of course, I'm not a psychiatrist, but so Captain Speculation here saying, I'm no psychiatrist, but I think it's schizophrenic. What is that going in the guy's records for? However, I think further psychiatric diagnosis and treatment is appropriate. So they're just covering themselves. And, you know, Gary Gordon, MD, you're going, I'm not, no, I've got one agenda. So, Warnick, they think it's this, spinal injury, but, I mean, if you guys think it's important, there it is. But it's the same thing upside down. So we've done that, Northwestern. Sleep was not, so that's been seen. So these aren't the official things, but we'll come back to that. I just wanted to get that out where I thought my head was cooked. So this is just another letter that I sent. By July, I was trying to get them to acknowledge that I'm addressing them, which they never did. So I had another contact, and I'm being civil. It was like between those dates, writing this letter, formal request to retain outstanding documents and information related to my hospitalization November 25th through December 5th. At that time, I was being treated for a diagnosis later determined as undetermined psychosis, and it was under medical supervision by Glenn. And this was after I knew I was out of the clear with herpes. But it's like, okay, now I know I'm going to make it. So it's like, where did you get this provided history? So that's why I'm asking her. Obtained in late December, I had all your records, 240 pages. Following items remain outstanding from the information already received. Where did you get this provided history? Who provided this information? Where was the reported history documented? Hackley records indicate urine drug screen was positive for benzodiazepines and methadone, both which prescribed prior to admission. Lab reports provided in prior submittal indicate negative for these drugs. So you say I tested positive, and the revised drug screen said negative, which they can do. I know that because I worked at Corporate Health for Camille Ferencz and know that they can click the switch and rewrite a report saying negative. God didn't give me knowledge for a reason. It's just I shouldn't have been using it. But I tried to catch them. It's like, oh God, we've heard it already. Please forward these missing documents to my attention, provide with red asterisk. I've made several attempts to contact Glenn and discuss these matters. However, he has not responded to my phone mail messages to date. I will continue making myself obnoxious until someone gives me a phone number or the attention I feel I deserve. Read what I actually wrote. That is like, come on, call me, write me. You know, I'm a lonely guy. Get to know me. Okay, settle down. Since I'm reinventing the wheel a lot because the Hackley stuff has been covered, I don't know if I need to go over it. But, you know, then it's throwing a dartboard if people are like, well, you write it or show it. And it's like, yeah, but, you know, this is when I went back a year later and read it. I mean, I'm just going to flash them up so you can stop. I'm not going to opine, but here they are. Because I don't know, it seems to be flowing okay. Well, I probably have to go over some of these. There's that. I mean, after a while you realize that there are avenues for a person to try and, you know, get justice for when they feel they've been wronged. Okay. Any complaints? Okay. So, July 20th, no one's doing anything. I find out, wait a minute, I get my rights, Office of Recipient Rights, so I can go complain about Dr. Quack's little practice. So I write, to whom it may concern, I'm submitting this formal complaint. Oh, Brian, I want to put that. See, I'm ashamed of that. It's like formal complaint to your attention regarding the incidences of those dates and the subsequent hospitalizations at Hackley under the medical supervision of Dr. Brian Glenn. Rather than decipher between the two major components that led to the atrocious outcome of my hospitalization last Thanksgiving, I have decided to include a partial copy of the police report that highlights the events as they occurred, meaning I mean business. Needless to overstate, the crimes involved are quite serious. So I'm letting these guys know that I'm pissed, and I want to know what's going on. Regarding the major complaints with Hackley, the following specifies these grievances. And I gotta wrap this up fast. BGS was refused access to medical records during hospitalization. Bob Bose, the then executive, this guy got fired. He got fired within a month. Whether I'm saying I had anything to do with it, but he got canned. Executive Director of Patient Relations Coordinator, and Dr. Glenn repeatedly denied this information, my records, and more importantly, documented these multiple requests as a patient being paranoid. Ha 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 ha. Admission documents indicated self-employed. See, all I do here is I acknowledge, but I don't know if I have the record. Although all handwritten records verify employment with Terracon. As a result, BGS me was treated as psychotic for a job that allegedly didn't exist. It says what it means. They said, your wife says you don't have a job. I have a job. I'm working at Terracon. Can you prove it? Well, let me call him. We can't let you call people. You're self-employed. You're making this up. No, I'm not. Well, you're psychotic. Oh, my God, it was a nightmare. Records indicate unreasonable concern over wife's safety. This was verbalized in general terms and not specifically identified as being related to the OxyContin and the missing pills. My wife has a narcotic drug problem that Dr. Glenn refused to acknowledge. Means what it says. BGS was refused to access to call employer to indicate situation and obtain company insurance. Medical history, both physical and mental, was grossly incorrect. Glenn noted prior hospitalization for orthopedic procedures as mental facilities, i.e., numerous surgeries were interpreted as past psychiatric history and hospitalizations. Also, history of present illness and participating events was long time. There's absolutely no foundation for this handwritten entry. And it wraps up. I think, oh my God, this guy goes on forever. So I'm not going to go. Glenn's credentials interpreted as being paranoid. Well, I got to do it. I requested Glenn's credentials. They interpreted as being paranoid schizophrenic. I was heavily medicated with antipsychotic medications, Geodone, Ativan, Zyprexa, Restoril, with doses of Geodone far exceeding recommended practice. Over 9 days, less than 24 hours of sleep was documented. MRI test, patient 47 with a provided history of herpes. What was going on? An MRI scan showed a remote infarct and abnormality in the right thalamus suggested of an infarct. It's like an ingrown toenail. It's an ingrown brain fart. That's what I said. This was totally ignored and disregarded. Despite my complaints about severe headaches and reaction to red lights. Who provided the information about previous history? Hackley records indicated that urine drug screen was positive for benzodiazepines and methadone, both of which were prescribed prior to admission. And initial history was provided mostly by wife Mickey in phone conversations. There has never been any prescriptions for benzoid or methadone for me prior to this date. Blood test results were ignored. Conditions representative of kidney failure, extremely low, then rapid change in white blood cells, elevated glucose, and BUN, whatever BUN was. And notably low. See, I had to look at my test results to see what else was going on. And it was like all these other things that went untreated. Low phosphate, because it doesn't take a brain surgeon to look at a report and see all the things that say below normal, above normal, exceeding the recommended threshold. So no blood tests. These were performed after November to monitor this condition? What? All these things are wrong? And it's like, well, it's good enough. Shredder. Reports of agitation and anger were preceded by antagonistic conversations with Dr. Glenn. I called him Dr. Quack without reservation. Glenn refused to inform or simply clarify what was going on throughout the period of hospitalization. Dr. Glenn did not report MRI results to me when they were released November 30th. Again, requests for information were documented as patient being paranoid. They would not tell me what was going on. And every time I got all excited, they're saying, you're acting paranoid. Your brain's baking and you've got really bad headaches and you're in a mental facility for the first time in your life. Why do you want to know why you're crazy? Do you get it? Do you get it? I'm not mad at you guys. I love you guys. I'm just saying is I tried to fight myself and didn't let God do it for me. I believed in God, but I didn't let Him do my fighting. I didn't have to do this, but I did. Anyway. In one instance on the first night, oh, here we go. BGS was cornered in a room by 5 other staff. And these were not just little guys. These were big guys. These were football linemen. And you decide what race and color they were. Reaction was considered paranoid because what I did was, and I gotta see if I wrote it before I say it, whenever BGS questioned staff interpreted as hostile or psychotic, gross interpretation of routine gesture. Okay, what I was going to say is, when these guys came in the room, I'm like, what's going on? Where's Mickey? What's going on? These guys came in, and they're 5 big black dudes that came in, and they go, you need to settle down. And I threw myself on the bed, on my stomach, prone position, threw my hands on my back in like cuff me position, saying, I'm not fighting you, I just want to know what's going on. And they just said, oh, he's paranoid. And I'm like, I'm not fighting you, don't come and tie me down. They had me on 15-minute watch with the door open, and I'm not sleeping, and they got a guy at the door with the door open, and I'm sitting on the bed like, what's going on? Tell me what's going on. Funny in a movie, but not when it's you. After 9 days, no sleep. So whatever you figure out, 24 hours in 9 days. It's like 3 hours a day, whatever it is. So medical records include 240 hours of documented behavior. Oh, it was just over and over. The guy's acting crazy. We don't know what to do. Generally speaking, the only apparent conduct that is consistent is the indication of physical pain as a result of not being provided my prescribed medications. When the guy's crying about his pain. Oh, he's had all those surgeries and they're not psychotic behavior? Well, let's give him oxycodone because that's what he was prescribed when they find out. Oh, is he going through withdrawals? Yeah. Is that maybe a reason he's upset besides his head breaking? Yeah. And Dr. Glenn, with the treatment and alleged mishandling of the alleged psychotic behavior, poses someone being refused treatment as an organic medical problem to include a drug interaction. The same day instruction is made to, then they said, you can't have any more. Brian, let it finish reading. The same day instruction is made prohibiting narcotic medication, then all of a sudden, BGS received an injection of Darvocet, followed by a prescription of 20 milligrams a day of OxyContin. It says what it says. Prescribing narcotics not only violate their own instruction, medical staff overseeing the approval are completely ignorant of the interaction between narcotics and the medications prescribed during the hospitalization. Meaning, they're feeding me anti-crazy pills, and then they give me exactly what was cooking my brain. The Heath Ledger cocktail. Do you see how absurd this is? They start giving me the Heath Ledger cocktail. And they're violating their own anti-drug policies. Oh, good Lord, is this ludicrous. This is probably one of the most blatant forms of medical malpractice I've ever heard of. Do you get it? They're giving me and all the anti-crazy pills say do not mix with pain meds, and then they're giving me pain meds, Darvocet? What am I missing about ludicrous? I know he's a singer. I'm cool. I'm hip with that scene. No, I'm not. Documented physical. I gotta wrap this up. I'm beyond my time. It's over. Document physical, mental conditions along with MRI reports, blah, blah, clearly reflect symptoms of encephalitis throughout this period, more than someone having their first psychotic episode at age 47. Obviously, there are more questions, blah, 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 intolerable. Ain't more, so I was civil. Hold on, it gets better.